Chris Gibbs and his wife started this farm in Shelby County, Ohio, from scratch in 1983. Today, he and his son operate 560 acres of corn, beans, and alfalfa hay, along with 90 registered brood cows. He's been very fortunate when it comes to health insurance, having spent 30 years with the USDA. But his situation is very unique. Not all farmers have federal health insurance. Dr. Shoshanah Inwood, an associate professor in the School of Environment and Natural Resources, recently presented research findings showing the disconnect between health insurance and farm life.
One of the surprising things that we found from the study for the health insurance study is that this is really an issue that is long gone undiscussed. This is the elephant in the room that farmers really want to talk about. That when we did the interviews, that they were crying and thanking us for doing this research because nobody ever talks to them about this. And everybody has a family that they love and who they want to be healthy. And it doesn't matter what you grow or how you grow it. This is an issue that affects all of agriculture.
While 90% of farmers are insured, that insurance comes at a cost that goes way beyond monetary stress. The vast majority of these farmers are insured through off-farm jobs, creating even more stress for families. In order for families to have peace of mind when they pass their farms on to the next generation, Chris says that it is critical to have a path to universal health care. He believes it's an economic driver that'll help expand farms.
Look at all of the economic activity we could create on the farm if we brought spouses back from town who are just there to get health insurance primarily. If we brought them back to the farm to create different enterprises on that farm and expand the farm.
Now, whether you think universal health care or some other form of coverage is the answer, the key to getting something done, according to Dr. Inwood, is to get everyone in the same room to hash these issues out. And that includes the ones who are actually making policy.
We need folks from across the health and human services spectrum at all levels of government, both state and federal, and also health insurance companies who are the ones who do the insurance policies to come into the room and to understand what is it that their clientele does and doesn't need, and how are these policies actually playing out on the ground.
And while every farmer's situation differs, Chris has always had a life goal for his operation, one that without having good insurance would be hard to achieve.
Our goal for this farm was always to build it from scratch, push it down through the generations, and then I'll know that I've done my job.